pharmaceutical companies, and it's considered as important export industry and ranked as a third sector for exporting. From the importance of this important section, we are working to implement the governance for medicine. Our working in governance for medicines aim to implement the governance in the pharmaceutical field and working both in the administrative level and in the technical levels to curb the corruption practices in the medicine fields, also to enhance the building capacity of the pharmaceutical field through working in the computerization of the pharmaceutical health sector and the universal health coverage. We start this work since 2007 after we take the clearance from the Ministry of Health. We start conducting a national transparency assessment. Then we develop the national framework for GGM, and now we are working in implementation for national GGM program, the strategic and action plan. Those are our stakeholders. We are working in an innovative way to collect both the governmental, private, and the civil society all work and working all together. Our stakeholders are the Ministry of Health, Ministry of Public Sector Development, JFDA, the Anti-Corruption Commission, Royal Medical Services, the High Health Council, Joint Procurement Department, the largest hospitals in Jordan, the Consumer Protection Association, and the representative from private sector, civil society, Hakim, and the Accreditation Council. As I mentioned, we are starting by doing the assessment for 6 major elements and important parts of the chain of medicines, and to measure the vulnerability for corruption. Those were the registration, promotion, inspection, selection, procurement, and distribution of medicines. We published the results on the WHO and on JFDA website. If anyone interested, you can refer back and have more information about this. But in brief, we found that the promotion is the most vulnerable for corruption, followed by inspection, followed by registration and selection, and where the procurement and distribution were least vulnerable for corruption. We end by the national workshop, and there was a recommendation by revised laws and administrative structure to work more on conflict of interest and conflict of interest management and publish more SOPs about governing these sections, and to formation and enhance the enhancement of the involvement of all the private, public, and civil society for both the steering committee and task force committees. Then we move to phase 2, which we are working and developed by the national consultation process with all the stakeholders and make a framework for the GGM work. We built this framework in 2 strategies, the discipline-based approach and the value-based approach. The moral value, we discussed the moral values and ethical principles and its effect on the medicine chain, such as justice, fairness, truth, service to common good, and trusteeship. We discussed more about the code of conduct. Since 2007, we did not do anything for the code of conduct, but now in 2015 we have a code of conduct, and we implement this from the Ministry of Public Sector Development, and we do many collaboration and arrangement of work together. Then we mention more about the socialization of an ethical framework and code of conduct, and the importance of moral leadership and how to build capacity on this issue. Then we also discuss the issues about the whistleblowing and sanctions under Municipal Acts, and how to improve the management system and building the capacity. Also, we address the importance of the role of the civil society organization and the media, and the importance to involve the private sector institutions and the political will here in Jordan. Also, in this work, we publish our GGM framework on the website and on the website of GFA and WHO as well. This is what I mentioned about how we work on our framework or on our work by discipline-based approach and the value-based approach to strategies. Here we can differentiate how we are enhancing the value-based approach by the promotion and enhancement of the ethical framework, the code of conduct, code of ethics, and the promotion of moral leadership. And the discipline-based approach by working hard. Actually, we are working hard and with the Anti-Corruption Commission, which also published many on the official gazette on 2013 and 2014 about the whistleblowing mechanism and whistleblowing protection. Okay, these are the guidelines for the Anti-Corruption Commission. Yes, we are working through the implementation of good governance for medicine in the pharmaceutical sector through the steering committee and through a task force committee. With this, the steering committee are members of the heads of all the stakeholders we mentioned before. They are all high-level policy makers and responsible for overall management, adoption, and evaluation of GGM program, and to ensure the implementation and recommendation made by the task force, which are the technical force and the technical committees to give the recommendations. The task force, actually, we are pleased to have a very energetic, and they are all work in volunteer basis for manage the national consultation process and follow up and act upon the recommendation and coordinate of development. By the end of phase 2, which ends in 2010 to 2011, we have recommendations to work more on code of ethics, code of conduct, and conflict of interest declaration and management. Then to follow up with these all and anti-corruption practices and revision of the laws, regulation, instructions, and term of reference for all the committee members. Now, with the implementation of the GGM, where we are working now, we are working to strengthen system by increasing the transparency and accountability, and to promote awareness for general public health professionals about the importance of having the good governance of medicines and the right of all citizens to have safe, effective, and affordable medicines. Also to build capacity for managers and public policy makers, and building capacity for our systems as well. This is our vision, the will set of His Majesty King Abdullah II about the importance of the involvement of the good governance for medicines through enhancement our implementation of justice, fairness, and rule of law, and transparency and accountability as well. We did many things through the phase 3 compilation of anti-corruption legislation, as I mentioned before. We're working now on conflict of interest management and conflict of interest declaration. Also, we working and we have a good progress in the universal health coverage. We are very encouraging that when we implement the universal coverage, all people will have the same right to have the effective and safe and affordable medicines as well and the treatments. We work in the disclosure policy, we work in the essential medicine list and rational drug use and drug promotion of SOPs. Also, Hakim, which is one of our partnerships, working very hard for computerization of health and pharmaceutical sector. They did a great job on this issue. And we are trying to make socialization and promotion for the concept of good governance in the conferences and the university courses. And also we are making good connection with others, international connections with our colleagues that are working on the same project as us. Finally, I would like to mention that Jordan addressed in the WHO report in 2013 with the good progress in the TGN, and they referred for the political will and governmental support. Thank you.
Thank you, Dr. Owen. Any questions? Please. We can hear you. Oh, you can't? Okay.
Thank you. Dr. Leila Badran, former advisor to the Minister of Health. Thank you for your lecture. My question just concentrates on the corruption and anti-corruption. Honestly, and till this moment, can you give us an example of the corruption cases that you have discovered? It's part of your work. Can you explain this more? Statistically. Example.
Actually, there is reporting for such cases. We are working very cooperatively with the Anti-Corruption Commission. So we as a GGM section or a GGM board, we are not have the right to interrogate or to discuss all the details of the corruption cases. So we're reporting to the Anti-Corruption Commission and they take the action. Yes, there are, and they are one of our, as I mentioned, they are one of our stakeholders, and they are very supportive and effective. The fourth one, the Anti-Corruption Commission.
Any other questions? Okay, well, thank you very much.
Thank you.
Well, it gives me pleasure to introduce Dr. Ala Al-Waisi. I met her in Qatar. She's at the College of Pharmacy in Qatar, and I was there for 10 days. Dr. Ala graduated from Strathfield University in Glasgow, United Kingdom in 2001. With a Master's of Pharmacy in 2006, she completed all elements of Hospital Pharmacist Stage 2 training program, which is a national vocational training scheme for Scottish pharmacists, and then completed her Master's in Prescribing Science from the Robert Gordon University in the United Kingdom in 2009. She's currently an assistant professor and assistant dean, right? Not associate dean yet. Coming soon, maybe. Assistant Dean for Student Affairs at the school at the College of Pharmacy. And she won several awards for her presentations in Kuwait and some regional kind of presentations. Her interest now is interprofessional education, and she does some research, and I believe she's going to present today about interprofessional education. So, welcome.
Thank you, Dr. Nasser, and welcome everyone. So I'm going to be talking about our experiences in integrating interprofessional education into the pharmacy curriculum. I presented this 2 weeks ago in Melbourne, and that's why I had the Middle Eastern perspective. And I'm very passionate about interprofessional education. As a pharmacist, as a clinical pharmacist, when I worked in the UK, I was amongst a lot of really excellent multidisciplinary teams. And as a pharmacist, I felt very well respected, appreciated by everyone in the team member. I was an equal member of the team, and it was a great experience. And I'm glad interprofessional education is something that everybody is moving towards. An outline for my presentation, I'll keep the time. I'll keep it here. So, yesterday I presented at Al-Batra, and I spent about an hour. So I can talk for more than an hour about this subject, but I'll limit myself today to 15 minutes. So I'll talk briefly about the College of Pharmacy in Qatar University. I don't know how many know about the College of Pharmacy. I'll define what IPE is. What is interprofessional education? You know, it's a buzzword these days. What is it? Also, I'll talk about our successful year of IPE, which we had last year, and we're building on it, and then some conclusions and challenges. So the College of Pharmacy in Qatar University is the first and only pharmacy degree in the state of Qatar. It's the first and only international program to be awarded the full accreditation status, that's the CCAP accreditation by Canada, We're the only institution out of Canada to have received this. I know some universities in the region are trying to seek it, but we are the only one who has the full accreditation. And we accepted our first class in September 2007. So we're fairly a new school, but if you look at what we've done, I'm very proud of the accomplishment that we have done in this short period of time. So the College of Pharmacy is committed to meet the expectations for competent pharmacists described by the WHO, and I'll not go into the different competencies that we make sure. Our pharmacists, there are always elements that we need to make sure they are caregiver, decision maker, communicators, leader, manager, lifelong learners, and teachers. We offer the PSC pharmacy program. As postgraduate study, we have the Doctor of Pharmacy, and we have Master's, MSc in Clinical Pharmacy and Pharmaceutical Science. So I always like to start with IPE, Interprofessional Education. So I'd like to start what is not IPE before I tell you what is Interprofessional Education. So as you can see in the picture, we have students from different professions: pharmacy, nursing, medical, and physical therapy students. They're sitting together in a lecture theater like you are, and there maybe someone is giving them a lecture about pathophysiology in diabetes. This is not IPE. So we don't really call this IPE at all, although it's mixed profession, but they're listening to the lecture. Now, in this picture, we have a pharmacy professor teaching medical students about the topic, maybe related to pharmacy or maybe not, in a classroom setting. Again, we do not call this IPE. In a ward round, the students are going on internship, and we have multidisciplinary students, so we have a medical student, pharmacy, nursing, and led by, in this picture, by a medical professor. However, everybody is looking at the patient or reading the case from their perspective. There is not much interaction, and there is no shared decision making. And again, we do not call this IPE. So what is IPE? IPE, as defined by the Center for Advancement of Interprofessional Education in the UK, it's an occasion when two or more professions learn with, from, and about each other to improve collaboration and the quality of care. So it needs to be, the element of interactivity needs to be there. People are learning with, from, and about each other. It could be in a classroom setting, round tables, or it could be in the practice setting as well. The WHO, back in 2010, they published a framework of action on looking and calling for healthcare professions to integrate interprofessional education within their curriculum. And one of the things that they were mentioning here is, these students, once they graduate, they will be working together. However, if we're expecting them to work together, should there not be opportunities within their education where they are studying together, learning from, with, and about each other? So hopefully, once we're integrating IPE within our curriculums, what we will have is a collaborative, practice-ready health workforce. This collaborative-ready team or health workforce will lead to a collaborative practice where everybody is working for the sake of the patient. And our optimal, our focus, of course, is the patient, patient-centered care, and optimal health services. Now, when did IPE start in Qatar? Like back in 2009, we had the Qatar Interprofessional Health Council. This was led by all the different deans from all the different healthcare schools. They've applied for a grant, Qatar National Research Fund, back in 2011, which they've received, and it was looking about implementing interprofessional education within the healthcare curriculum. One of the things that came out from the study is, one of the things, we want to do IPE, but of course we need to be thinking about what is it we want to achieve from doing this IPE activity? What are the competencies that we need the students to have achieved? So they came up with an IPE shared competencies. Now, in the States, in Canada, in the UK, they do have, they've developed shared competencies. What they did here is we adopted or looked at several frameworks, and they've adopted one and tried to adapt it into the local needs. So the things that they have focused on was role clarification. I need to know, okay, of course I need to be quite confident with my own professional role, but I need to learn and understand the role of other healthcare professionals. Interprofessional communication, that is something that is essential. I might be quite good at communicating with a pharmacist, someone with the same knowledge that I have. But what about communicating with someone with, it's a totally different profession. Sometimes we might feel, oh, actually, I'm not really confident about speaking with someone. So interprofessional communication is quite important. Patient-centered care, everything we need to do, we need to make sure that the students, what we're thinking about is not that I'm doing my job, I'm doing my role. What is our focus is the patient. So all of us in the healthcare team should be focusing on the patient. And of course, we need to be sharing decisions. Not just one person within the team making the decision on us. We need to all agree and be liable for the decisions that we're making. Now, with this council, they were all enthusiastic. However, in Qatar, a lot of there is quite sometimes a large turnaround of people. So a lot of the deans who were in this council left, and then okay, who's going to take the lead in this important initiative? So in 2014, as I said, we have the Canadian accreditation, and we received the full one. One of the things that was focused in the report, they asked that we need to work more. We need to show more evidence that we're integrating interprofessional education into our curriculum. So our Dean, Dr. Ayman Al-Qadi, asked to establish the first interprofessional education committee within the College of Pharmacy, which I'm chairing. And one of the things that we did with this committee is providing guidance and support in implementing interprofessional education, not just within the College of Pharmacy, but within also the other healthcare professionals. So I'm really proud that for us, pharmacy was leading the integration of interprofessional education into the curriculum. These were the representatives. So what is unique about Qatar is, every healthcare curriculum or profession is in a different geographical location. So we have Weill Cornell Medical College, the leading branches in the state. We have the University of Calgary for nursing. We have the College of North Atlantic, and we have the College of Arts and Science in Qatar University. And the new College of Medicine within Qatar University has just been opened this year. So there are various models of IPE, how to integrate IPE within our curriculum. Now, we've looked into these various models that is available. And as Dr. Nasser in his lecture, he said, yes, there is excellent models available, but we need to adapt them into our local context. So one of the things I found that could be quite useful and is can be applicable and feasible for us to implement was the Ontario pre-registration interprofessional education. So we've used this as the basis for integrating IPE into our curriculum. And we have to come up with different activities that are suitable for the local context. So what is done in this model, in the first years, we're exposing the students into the concept of IPE. Then as the year goes up, we're increasing the complexity of the different IPE activities that we're having. Within our committee, we are not just focusing on the curriculum, but we are focusing on different issues. So curriculum, yes, we're focusing on research, faculty development, which is essential for having successful IPE, and also the student-led initiatives. So back in June 2014, we sat as a committee, we planned, we said, okay, so what is it we want to do? For every professional year, we want to have an IPE activity, at least one. If we can have it in both semesters, then that's fantastic. And then we had someone who's leading this IPE. I can't do IPE on my own. We have to, it has to be a shared thing. So we were increasing the complexity of the different IPE as it goes. So for first year students, we just want to introduce them to what IPE is, started the activity with an icebreaker, introduced them to the concept of IPE. we had a game, a simple game about, maybe it's not a simple game, but it's called Which Profession Game. So what we had was, the title of the profession and then a description, and the student had to match, as you can see here in the picture, student had to match the title with the description. Also, we gave the student a simple case about a patient who was admitted with diabetes, and we asked them, okay, please think, what profession do you think will be involved in, this patient care? For second year, so now we're moving up, we were looking more about interprofessional communication and maybe some decision making, some shared decision making. So within this activity, we had the 6 healthcare professions: emergency medical science, medical radiographer, medicine, nursing, pharmacy technician. So we had 112 healthcare students, as you can see in the picture. 16 facilitators, so not 1, not 2, but 16 facilitators who were very well trained on this activity. The agenda was, this activity was for about 3 hours. We started with, again, icebreaker, which is essential. Then we showed them a video about someone who just went for a routine surgery. This patient, due to some team dysfunctionality, the team didn't work very well, the patient died. She was totally fit, totally healthy. So the student had to go through this and try to, once they watched the video, they had to reflect on what they saw. And then as a student, as a pharmacist, where can error happen? If miscommunication happens, where can it happen? As a medical student, okay, where can it happen in the medical profession? As nursing. And as you can see, when students are talking about their profession, they're learning about each other. And then we had, again, another similar case where students, it was about somebody who was admitted with a paracetamol overdose, and then, going through the different journey, where did they had to read the case and reflect on where the errors happened within this case. Also, in second year, we had, with this activity, the focus was to establish an IPE smoking cessation clinic. They had to first watch, again, a video about motivational interviewing. Smoking cessation is something not, different healthcare professionals are essential in providing care providing interventions and care for smokers. So within this activity, what they did is, they watched the video about motivational interviewing, a good video, and then maybe not so good motivational interviewing, had to reflect about it, and then think about establishing an IPE committee, an IPE smoking cessation clinic, and which professions were involved. I think we're almost,
If you could wrap it up, because I think they said the bus is waiting.
Okay,
So
sure.
if you could wrap it up.
We have also had some IPE within our ESPA rotations, that's within internship. As I said, faculty development is very important, so we had, we had 2 experts from Aberdeen who came